Hi, I'm JJ. I'm a medical provider currently practicing in northeast part of the United States. To briefly introduce myself, I studied biochemistry as an undergrad and I have an extensive biomedical science educational background. I completed numerous graduate level biomedical science courses such as microbiology, pharmacology, pathology, and molecular genetics. Also, I have actual bench research experience, and one of them involved dealing with telomeres. I attended US-based education program, and I received a lot of clinical training, both inpatient and outpatient. Also, I have experience dealing with military medicine. At this time, I work in outpatient clinic that deal with all kinds of patients. I see pediatrics, teenagers, and elderly, patients as young as 2 to 3 months old and as old as 100 years old. In terms of AI, I'm not an expert. I'm not a programmer. I'm not involved in the tech sector. I know as much as what I read on the internet and what I learned from Wall Street. I'm an avid investor and I've been hearing about AI a lot in the past 2 years. Nvidia, Palantir, these are two of the companies that exploded because of the future potential of AI. Out in the real world, every big tech companies are racing to get the best AI product out there. Right now, generative AI is the big thing. What AI does is gather all kinds of data, analyze them, interpret patterns. They are able to mimic different styles and structures and synthesize most relevant information after gathering and analyzing and collecting all kinds of data. So why am I creating a YouTube channel based on AI and medicine? Well, because I believe that AI will transform medicine. How will AI transform medicine? How can AI be utilized in medicine? Well, at this time, AI makes it easier to look up information. It is efficient, it helps save time, it makes one work more efficiently and effectively. In the past month and a half, I've been using some AI programs during some patient encounters, and I can tell you, it does a really good job of providing necessary information. Of course, I don't totally trust it right now. It is new. So I had been going back to other medical contents like UpToDate and comparing the answers from AI to UpToDate. I would say about 95% are accurate. AI does a good job of pulling out all the relevant information. It has helped me save time for sure. There are some similarities with AI and medicine. Medicine is all about collecting relevant data. When I look up medical information using AI platforms, I get answers quickly. Also, they answer my questions very thoroughly, yet concisely. I find it easier than looking up information from medical contents like UpToDate. Medical personnel, those who have used UpToDate before, they know there is a lot of information that needs to be sorted through. While with AI, you can get answers in seconds. Sometimes with programs like UpToDate, it can take minutes. Of course, AI is new, so I'm not relying solely on it. So I've been comparing information I get from AI with UpToDate. And I have to say that about 90% of the information you get from AI is accurate. I use AI as quick reference and it has been very helpful. What AI does is neatly lay out information. You can glance through it quickly and obtain a lot of information in short amount of time. It reminds me what I overlooked, and it helps me approach clinical problem from different angle. AI lays out a lot of good information very simply. So all I have to do is quickly glance through it. And in terms of dealing with patient care, it helped me think about some things that I had not considered. In addition, AI can be used to help organize medical writing. After you gather all the data, you can just briefly type in different information. If you ask AI to organize all the information in specific medical format, it will do that for you.